often throughout the working day, I'm suggesting to parents that they come out and have a chat with you as a baby wearing consultant about issues that have come up for them using baby carriers. So I wondered whether you could actually let us know a little bit about some of the most common issues that are coming up for parents.
Sure, Pam. Some of the most common concerns that parents have is about the hip and leg position of their babies, and they're really concerned about opening their baby's legs out too far in that spread squat position. But I find once I reassure parents that that position is actually normal for their baby, and when they lie their baby down, they'll notice that those little legs will come up into that froggy position, and that's ideal. That's actually how we want to support those babies' legs. Particularly for the first 3 to 4 months, it's really important to have those legs tucked up nice and high, with the knees for that newborn up high level with their belly button. So indeed, a good carrier or baby wearing device will support that baby in that little froggy leg position, and that's what we're looking for. The other concern is about how to wear their baby safely. There has been some concerns, so we always want to wear that baby tight and upright against our body, no longer in the horizontal position. So tight and upright, and a good baby wearing device, you will actually be able to tighten around your body and tighten against the baby so that you're getting a nice snug fit, and the baby is firm and upright with the ability to get a couple of fingers under the chin, and that helps keep the airways clear. So a product that can't be tightened, sometimes the baby can slump, and then that is at risk of compromising the airways. So those are the two key things. A product will support those babies' thighs from hip to knee adequately for the first 6 months at least, and keep that baby tight and upright against your body. And in a real baby, indeed, the knees would actually be tucked up that little bit higher. So that lovely hip to knee support for that thigh. We've got a soft but supportive area across the spine to support that developing spine, and head support. And there is a nice technique too you can do with ring slings to give the newborn baby extra support, and that's simply tucking the towel across the back there and folding the ring sling back over. And you can also do that with just a fine piece of fabric or a face washer. And for the little bub, that just gives them that nice extra collar and support around their head. And you can see that the baby is nice and firm and tight. If I bend over, the baby doesn't come away from my body at all. So she's nice and firm, therefore she's not going to slump and risk the chin collapsing onto the chest, which can compromise the airways. Once baby's settled and asleep, they're quite comfortable there. You can go about your day. We do recommend for safety not doing things in the kitchen, for example with knives and hot elements while you're wearing your baby. And if you're needing to bend over, again use your legs and bend rather than this way. But instinctively you will support your baby's head, and that's fine as well. Taking the baby out is easy. We just lift the slings. Baby can stay against your body, so there's minimal disruption to baby. Ease the sling back to the legs, and then easing baby up. A baby wearing device is a real sanity saver for parents, and if you're needing any help or support, come and see us here at the Possums Clinic. Baby wearing is a fantastic tool because it does give that variety for that baby. Many parents are under the belief that that baby must learn to sleep by itself in a device with no human contact, whereas indeed being on a body and attached to a body is a normal biological norm for infants, and so they're usually much happier when they're attached to a body. And you can quite safely, if you're wearing your baby in a safe device and worn safely, you can allow that baby to be on your body, sleep during the day and nap as they will, and having them in and out as the baby needs, and attending to those cues is certainly a great way to go. And baby wearing certainly facilitates that cued care.
Yes.
And you can alter positions, take the baby in and out, attending to those cues. Baby wearing is a fantastic tool for getting out and about. Sometimes prams are a little bit limiting, particularly if you're relying on public transport, for example. And I know I often find babes in arms and an empty pram being pushed, and having a baby in a safe baby wearing device is often safer than having them just in your arms while you're walking around. So getting out and about, and after those four walls can seem to be closing in for a new parent, having an easy way to take the baby with you and get out and about and enjoy the outdoors, or even if it's a shopping trip, then baby wearing can certainly facilitate those outings. You know your baby's on you, the baby is safe, and you're not having to worry about juggle a shopping trolley and a pram, which is practically impossible, and so baby wearing becomes a must-have tool for the new parent.
A wonderful tool. As parents we need many, but this is certainly one to have in your toolkit.